Hello parents, soon-to-be parents and all guardians. Welcome to Life with Little Ones channel. And in our today's video, we will talk about ear infection, signs and symptoms, diagnosis, treatment and prevention. This video I made is a parent's guide on how to take special care of your little ones if they are suffering from ear infection. So let's get started. Children, including infants, are susceptible to viruses and germs that cause various kinds of infection. When these germs crash into the ears, several kinds of infection can take place. A swimmer's ear infection afflicts the outer portion of the ear. And then, when the infection hits the inner zones of the ear, the case gets labeled as middle ear infection. The irritating disorder causes the body to react by releasing yellowish viscous liquid or pus to the infected interior parts of the ear. The sticky liquid contains compounds that fight off bacteria, and so the process of staving off ear infection creates pain. The interior of the ear beyond the eardrum looks like a small air pocket. And the moment pus fills this portion of the ear, we feel as if something is going to explode. It creates throbbing sensation that makes us irritated and uncomfortable. And this experience can get nastier among children. The infections, the process of fending them off, and the resulting pain and irritation can get complicated and may cause fever. And also, the clogging of the interior parts of the ear with the antibacterial liquid can create difficulties in hearing for some children. The infants under the age of 3 are the least capable of coping with ear infections. The reason behind this is because the eustachian tube which connect the throat to the inner portion of the ear are not yet fully developed among this age group. And these tubes facilitate air movement within the inner portion of the ear. With underdeveloped tubes, hostile germs trapped inside them multiply more easily, causing greater harm to the body. And as the child grows, however, these tubes also increase their capacity to expel unwanted intruders such as infection-causing germs and viruses. The common cold, which victimizes more children than adults, can also cause ear infections. This happens because cold likewise triggers a process that leads to dysfunction in the eustachian tubes, allowing germs to slip into the middle portion of the ear. Hence, although ear infection by themselves are not contagious, they can easily spread through the cold virus. The family is therefore well advised to seek the help of physicians when any one of its members shows signs of ear infection or even a recurring case of cold. The doctors examine the afflicted ear with a medical device called Otoscope. This special apparatus emits light and makes the eardrum visible. The eardrum is a delicate thin membrane that separates the external portion of the ear from the interior parts. And when needed, the doctor can also use the otoscope to blow air into the ear and test the eardrum if it is working. The pus that fills the middle parts of the ear as a natural body responds to the infection, presses the eardrum, and may cause it to turn red, swollen, and disfigured. In such cases, doctors recommend that a dose of pain relievers be taken for a couple of days. And moreover, they will prescribe antibiotics for infection cases that are caused by bacteria. Applying antibiotics can effectively check infections, but it must be done thoroughly and consistent with what the doctor prescribes to prevent the disease from coming back. Children who get inflicted with ear infection too often might be required to undergo other tests like tympanogram and otogram. For parents, children need to be extra careful to prevent ear infection. Remind your children that regular washing of hands is very important because this prevents the spread of cold viruses. And in the same manner, children need to keep distance from people who suffer from cold. But if contact with persons who are infected with cold cannot be avoided, they must thoroughly and frequently cleanse their hands and avoid touching their nose or eyes. And also, my dear parents, please remember that tobacco smoke adversely affects the normal functioning of eustachian tubes and can create dire consequences for children. Smokers will therefore do the children a favor if they keep themselves away from children. And that's all for today, my dear parents and all guardians. Thank you for watching. If you liked the video or you learned something, hit the like button. If you want to see more videos, hit the subscribe button. And if you have something to say, just leave a comment down below. Have a nice day, everyone, and I hope to see you on my next video. Thank you and have a nice day. Bye bye.